Hello and welcome everybody to this talk on occupational therapy. In the next 15 minutes, I'll be talking to you about what occupational therapy is and to give you a feel for the job. As an occupational therapist, I'm often asked what is occupational therapy. It can be a difficult job to describe, and a lot of people may have misconceptions about what it is. Here is a video that will explain what is occupational therapy a bit more to start us off. I will let you watch this video now.
We all have life goals, things we need and want to do. Sometimes things get in the way of our goals. Life events can make our goals seem impossible.
I love gardening, but it's difficult because I have arthritis.
I want to drive my car, but I couldn't after my stroke.
I need to find a job, but it's been challenging since being diagnosed with schizophrenia.
I want to make new friends, but it's hard because I have autism.
I need to get dressed in the morning, but I just had a hip replacement and can't bend forward.
I have difficulty managing my responsibilities because of my anxiety disorder.
I haven't been able to ride my bicycle since I had a brain injury.
I need to do my grocery shopping, but it's difficult to remember when I have dementia.
It's tough to care for my baby because of my carpal tunnel syndrome.
I need to walk my dog, but I have multiple sclerosis.
I want to learn the guitar, but my right arm is amputated.
I had a spinal cord injury, but I want to live on my own. My occupational therapist helped me to achieve this goal.
Occupational therapists help people to find the tools and strategies they need to overcome barriers such as illness and disability and reach their goals.
Now I live on my own.
I'm learning the guitar.
I can walk my dog.
I can care for my baby again.
I am able to do my grocery shopping on my own.
I can ride my new special bike.
I am working on managing my responsibilities.
Now I can dress myself.
I'm making new friends.
I'm working with my OT to find the right job for me.
My OT helped me to drive again.
I have a garden now.
Because of occupational therapy,
I can!
So hopefully from watching the video, you will have a little bit of a flavour of what an occupational therapist is. And as I've said before, as an occupational therapist, I sometimes draw blank stares when people ask what job I do. I think there are misconceptions about what we do, and that's because of the broad range of settings and areas that we work in. So for example, you might have met an occupational therapist in your own life, and it may have been in lots of different ways. Somebody may have seen an occupational therapist in a paediatric clinic, or their grandparent may have had an occupational therapist come out to their house to assess for equipment. You may have met an occupational therapist in a mental health facility or in a primary care centre. So we work in lots of different places and with all age groups, so it can be hard to pin it down. So hopefully that video gives a nice explanation of all the areas that we can work in. So I want you to imagine for a minute what it would be like if you couldn't get out of bed unassisted, or because of an injury you couldn't lift a kettle. Our daily activities give us a sense of identity and purpose. So if an individual is unable to do what is important to them, their health and well-being can suffer. And that's what the main point of occupational therapy is. We believe if people aren't able to do what they need and want to do, that they will not be at their optimal health. So occupation is the word we use, and it means whatever a person does in their daily life, and it can be broken into the areas of self-care, productivity or leisure. So occupations are everything we do, such as getting out of bed, making a hot drink, using public transport and socialising with our friends. And just to share a definition of occupational therapy helps people to do the everyday things that they want to do and need to do. And when people are faced with illness, injury, disability or challenging life events, this can be disrupted. The primary goal of occupational therapy is to enable people to participate in the activities of everyday life and to live their lives to their fullest. So there are 4 key features of occupational therapy that I'll talk you through now. So the unique focus of occupational therapy is on the person's occupation. So as I've said already, all the things we do to take care of ourselves and others, socialise and have fun and work. So our training means that occupational therapists understand how illness, injury, disability or challenging life events can affect people's ability to do the day-to-day things that are important for them. Our area of expertise is in assessing how different health conditions can affect people's abilities, and then problem solving and helping people overcome those difficulties that are affecting their daily occupations. Another key feature of our profession is that we always focus on people's strengths, and the client's preferences is what always guides our interventions and what we do. Independence is a word we use a lot, and that's one of our main aims, is to make a person be as independent as possible in their everyday life. So as you can see, occupational therapists can work in a variety of areas. And just to highlight, one of the unique attributes of a career in occupational therapy is that occupational therapists are dual trained in both physical and mental health. The undergraduate programs in Republic of Ireland and the program in University of Limerick, you qualify to work in both mental health and physical health. So that means we can work in a variety of areas. So you may be working in paediatrics, and that may involve working in neonatal care, early intervention teams, working with children who are school age, and working in child and adolescent mental health. You might also be working in intellectual disabilities, so whether that's children or as they move into adulthood and into residential care or at home in primary care. You may also work with physical and sensory disabilities, and that might be in people's homes or in primary care setting, in the acute hospital setting, or else in a rehabilitation setting. We also work in mental health, and that could be in working in a community mental health team or in an inpatient service or homeless service. This isn't an exhaustive list of the places where occupational therapists work, and we can also work in many other different areas. A big part of being an occupational therapist is working in a team. No client is ever treated by only just one profession, and everything works better when we work together. So occupational therapists work very closely with social workers, physiotherapists, speech and language therapists, nurses and doctors, psychologists, dietitians, teachers, podiatrists, and the list goes on. But most importantly, we work with the patient and their family that presents to us. I think we've touched on where we work. You can see there's a lot of different areas. You might be working as an occupational therapist in the hospital. You could be working in the person's home if you're working in primary care. You could be in a primary care centre. You could be based in a school, private clinic, day hospital, or rehab setting, and the list goes on. Here are some questions in general about should I be an occupational therapist? Do you mind having close physical contact with people? As an occupational therapist, you will be in touch with people who are sick and require physical assistance. Being a good listener is a definite. You need to be able to be empathetic and use active listening skills. You also need to be confident and be able to convey information to others verbally and be happy to stand up and talk. And as we've already said, working on a team is a definite if you want to be an occupational therapist. Occupational therapists are also really good problem solvers. We search out for lots of answers and we use trial and error to get the right one for our patients. So a saying here is that hopeless into hope, can't into can, impossible into possible. And I think that really sums up occupational therapy, that it's all about turning the cans into can for our patients. So now I'm going to talk through a little bit about a day in the life of an occupational therapist in the acute hospital setting, as that is the area I work in. So my job as an occupational therapist, I work in the general medical team for occupational therapy. And what this means is that we cover a lot of different specialities, such as cardiology, rheumatology, neurology, respiratory, and so on. And what this means as an occupational therapist is that you need to have a very broad range of knowledge of lots of different medical conditions. So it can be a bit unpredictable, so you could be seeing lots of different things every single day. A typical day for me is that I come in at 8 o'clock. 8 to 4 is our core working hours in the hospital. And when I come in, I start my day with administrative type tasks. So that means I have to get my referrals, which are on an online system. So I log in and get my new referrals, and I have to prioritize. Unfortunately, we always have waiting lists and not everybody gets to see us all of the time. So we have to ensure we prioritize to make sure that those who have the greatest need avail of our service. So every morning I would spend some time making sure I prioritize my caseload and the referrals that are waiting for my attention. And then I make a plan of who is most important to go to see on that day. I generally then go up to the wards, and before seeing a patient, I would check the medical chart and liaise with the nursing staff to see how the patient is that day and if there's been any change in their status. The typical type of assessments and interventions that I might do as an occupational therapist would include seating assessments. And what I mean by that is that sometimes people, for different reasons, require help to sit out of bed, and they may need a wheelchair or a high support seating system. So people may have different reasons for requiring this, such as a chronic neurological condition, such as motor neuron disease or multiple sclerosis, or maybe somebody has poor trunk control and are very weak and they tire very easily, so they wouldn't be able to tolerate sitting in a standard chair. So we would do a seating assessment, which consists of looking at their sitting balance, their movement in their joints that's available to them, and their activity tolerance and so on. We would then bring them an appropriate chair to meet their needs. Another task that we might do is activities of daily living assessments. And what I mean by that is assessing people's ability to function. So it might be to see, can they get in and out of bed on their own? Can they go out to the toilet? Can they dress themselves? Are they able to feed themselves? So we would do a lot of that at the patient's bedside while they're in hospital. And that assessment determines whether they're safe to return to live at home on their own or what help or care they might need. So we would often make recommendations to the social worker that the patient may benefit from home help, as the patient may need some help with showering and things like that. Another thing we do is cognitive assessments. So occupational therapists are experts in assessing cognition. So what that involves is looking at thinking skills such as attention, memory, and problem solving skills. So we would do that, and there are lots of standardized pen and paper tests that we do with patients. And then we analyze those results in relation to that person's daily life and what those results mean for them. So sometimes people have memory impairments, and we may need to put in some safety or education strategies for home. Other things that we might have to do on a daily basis is splinting. So you'll see in the picture here our hand therapy room. So for different reasons, people may have difficulty with their hand function and may require splinting. So maybe for increased tone, so if they have spasticity in their hand or pain or things like that. So we would be called in for splinting. Another important part of the job is communication with team members. So you're constantly checking in with other team members, either through reading their notes in the medical chart, talking to them on the wards, or attending multidisciplinary team meetings. I would also make lots of phone calls, maybe to family members, to ask questions about how somebody was doing at home before they came into hospital. I might also link with our community occupational therapy colleagues via written referrals or phone calls. And we'd also liaise with the public health nurses and other colleagues in the hospital. Documentation also is a very important part of our job, so you have to document all your assessments and interventions in the medical chart. So you can see it's a wide variety of skills that you need for the job, and hopefully this has given you an idea of what it's like to be a hospital OT. And just to give you a little bit of a recap, occupational therapy can be described as teaching skills for the job of living, and that's what we do. It's how do people want to live? What do they need to do and want to do? It's all about problem-solving occupational performance deficits by adapting the environment, the occupation, or influencing the person's capabilities through rehabilitation or compensation. It's all about maximising a person's independence. Occupational therapy is about helping people to be able to do what they want to do or are expected to do. Occupational therapy designs a program to help the individual bridge the gap between what they can do and what they need to do in order to lead an independent and fulfilling life. Thank you for listening, and if you have any questions, please email me at sarah.lydon@hsc.ie.